And finally, GHI believes in the organizational sustainability, both of the cooperatives and of GHI. So we have relied up until this point on the surplus crops to be sold to generate some income, but we believe that the cooperatives can generate significantly more amounts of income to sustain their activities. So what we do is we partner with the cooperatives around some agribusiness opportunities that we have identified, such as beekeeping, greenhouses for tomato production, and mushroom production. All of these do not require high levels of labor. So we partner with them and once again look for payback for over a period of about 2 years to ensure their buy-in in terms of the program in the long run. And hopefully the idea with the agribusiness investments is the payback will finance some of our activities, our administration as well.
So I want to give you a sense of the enormous impact we've had as an organization over just the past year and a half. And keep in mind as I'm going through this that we've accomplished this with just over $70,000. So imagine what an additional $50,000 could do for our organization. So we have helped establish 9 legally recognized agricultural cooperatives comprising over 4,000 HIV-positive individuals and their families in one district of Rwanda. 15 hectares of the land that have been granted by the local government have been cultivated, but an additional 50 are available for cultivation. We've established about 600 home gardens for individual households. Just under 50,000 kilograms of vegetables and fruits have been harvested in just under 3 seasons. And about 6,500 have been generated in revenue from sale of surplus crops. And to give you an idea of what that means for this community, the individuals with which we're working live on less than $2 a day. And while this isn't a huge amount for any individual person, it's the first time that as community groups they have had any capital for community activities and other things that they want to do. We've trained 36 of these HIV-positive individuals in nutrition counseling, so they work with their peers to propagate the training that we do weekly. And we've also trained 36 individuals in agricultural techniques for the same reason. We have, as Emma mentioned, a wonderful staff in Rwanda, and these are people who are very invested in and really are leading this program. We have 2 agronomists, one focused on the home garden program, one on the communal land, a nutritionist, and a project manager who's been involved since the outset. And also a woman who graduated from Yale last year is serving as our country director on a volunteer basis. She received a fellowship to do that, and you can get a sense of sort of her effervescent nature and passion for what she does. In this last point, she insisted on making the entire front lawn of our partner organization's building, this Rwandan network of people living with HIV/AIDS, into a community garden where people can come and learn techniques. So it's something we're really excited about.
So we believe that as we scale, we can create a sustainable financial model that will allow us to continue to invest in new cooperatives and will allow the cooperatives to continue to invest in their agricultural activities. But we want the cooperatives to be as invested in their agricultural productivity and their business success as we are. So initially what you see here is the cooperatives each member pays a $2 nutritional mutuelle. There are about 250 members in the average cooperative. Mutuelle is the name of Rwanda's health insurance program. So with this initial buy-in, we're trying to strengthen that nutrition-health connection, and we're also trying to ensure individual member participation. Then we have our community garden loan. It averages out about $2,225, paid back over a period of 2 years. The agribusiness loan averages about $3,500, once again repaid. The community garden, the home garden investment comes out to about $15 per person, so $2,950 for a cooperative. And that is something we feel so strongly about with that direct access to the food that we're not looking for any payment. In strict monetary terms, not including our technical assistance or any administrative costs, our net investment is the cost of that home garden grant, the $2,950. And for the cooperative, it's $500, which is the cost of the nutritional mutuelle. This is our model as it stands. However, we are currently very closely monitoring it to see where we can charge interest, hopefully with some of these payments, so that we'll reduce our initial investment and start to pay off some of our administrative costs as well. But nevertheless, it creates mutual value. On our side, as the payment is repaid, we can reinvest in other cooperatives. And on the cooperative side, they can sustain their agricultural initiatives, hopefully for many years to come. We're 2 years out right now. So this is taking the individual cooperative model and showing you what it looks like for 10 cooperatives. Our staff and administrative costs of about $40,000 we believe can sustain 10 cooperatives. So it's important when you go to scale, you notice that we spend about $120,000, we receive about $60,000, our costs are about $70,000. And for our expansion plan, we want to work with an additional 10 cooperatives each year for the next 5 years. So the important thing to note here is that our individual cost per beneficiary goes down as we go to scale and work with more people.
So what can $50,000 accomplish? As you can see with our implementation plan, that would allow us to expand into one additional district in Rwanda. So we'd be able to work with an additional 2,500 individuals on both a community level with large plots of land and also on a home garden level. So they'd each household would receive one of those. So why is GHI a healthy investment? First of all, we have a broad tangible impact. Through improvements in nutrition and antiretroviral adherence, we're really following a revolutionary approach in Rwanda and throughout Africa and really the world. No other organization has chosen to address malnutrition and HIV simultaneously, even though this vicious cycle is recognized at an international scale. Second, our program is very cost effective, especially when compared to the short-term food aid. We invest in the immediate and we get returns throughout the long term. And as you can see, the cost per beneficiary decreases over time. Can we finish this slide? Okay. We're also sustainable across many levels, as Emma mentioned, organizational through the loan repayment scheme, agricultural, we use particular agricultural techniques that will ensure the long-term development of the land, and finally at a cooperative level through the agribusiness programs where we generate income. And finally, it's replicable. It's easily replicable throughout Rwanda and actually throughout much of Africa, especially as we're getting repaid on our investment. Lastly, just I wanted to say this, so agriculture is not typically associated with health, but we feel strongly that they do form a strong and necessary link. And we are committed to proving that collectively and cooperatively, chronically ill patients like those affected with HIV can improve their health and nutrition through low-cost sustainable agriculture practices. And we hope that you will join us in investing in the livelihoods of HIV-positive individuals in Rwanda, working towards a more comprehensive model of HIV prevention, care, and treatment, and also in improving the qualities of life for those affected by this devastating disease. Thank you.
Thank you.